welcome in to be our guest and to your health. And we are very fortunate today to have with us Elana Merriweather. And Elana, you are the Behavioral
Health Officer for Medical Advocacy and Outreach.
So this is very important and it's very timely. We've been hearing a lot about the drug situation from a criminal perspective and from the police perspective. You're going to share with us a little bit different perspective on this, and I think it's something, no matter what your age, audience, that you need to listen to. So I'm going to turn this over to you, Elana, because you know what you're talking about.
Well, we just want to make sure that we are increasing awareness through prevention as well as education messages in the community to everyone about the dangers of substance misuse, with specific emphasis on fentanyl, of course, because there has been a lot of information going on nationally that has been disseminated about fentanyl, okay, and also carfentanil as well. And so one thing that we just kind of want to make sure we emphasize is that there has been a significant increase in overdoses resulting from fentanyl use over the last couple of years. I mean, there's been a significant increase between 2020 and 2021. And so we also have to consider the fact that there's about a 75% of counterfeit drugs, okay? Counterfeit drugs have been infused with fentanyl. And so what is so important is that we do what we need to do to be mindful of prescription drug use and taking advantage of opportunities to properly dispose of medications. But the main thing that we try to just communicate to people overall is the importance of not taking medications from anyone who is not a prescriber, only accepting medications or prescriptions from your primary care physician or whatever specialty physician that you have, and following the directions that are given from that particular prescriber, because what we want to do is decrease opioid use disorders. We want to decrease substance use disorders, and it starts by just making a personal commitment to following directions, just following directions overall.
Well, I think, when we take a look at it, I think what I hear you saying is you don't, for one thing, say you've got a friend here or there, my back hurts or this or that. Oh, I've got great pills for that. Don't you touch that.
Absolutely. Do not take anyone else's medications. Take your own medications. And not only do you take your own medications, you take your own medications as they are prescribed by your primary care physician or your doctor. That's what's so important, because everyone has a prescription for something, and we often get in conversations with friends and coworkers about different types of, this is aching or that is aching, and somebody say, well, I had absolutely, don't take it, okay? No matter how much pain you might be in and need that medication, do not take anyone else's medication, because you do not know when it might be infused with fentanyl, or when that small pill that looks like a piece of candy could be a lethal dose that actually takes you out. Okay, because that has happened to a lot of people, and I think right now we're in a place where everyone has been impacted in some way by overdose, whether it be in their own family member, within their own families, or someone that they know. It's really on the rise now, and these are things that we really have to be mindful of.
I think one of the other things that we should be aware of, if you have prescriptions that are legitimately yours and you actually really need that, but where are you keeping those? And can children get to them? Can teenagers get to them?
Right. And what's important is that we are mindful of safe disposal. Okay, not keeping medications in a place that is easy to access, where they're easy to access by children or people that just don't need to be accessing them, but also just being mindful that when we have unused or expired medications, there are places that we can dispose of them. We encourage people, don't flush your medications down the commode, okay? But what you can do is take them to a disposal site and get rid of those medications. Number one, so that they do not get into the wrong hands. Number two, so that we can prevent overdose deaths in the community. And also number three, just so that we can continue to launch initiatives that focus on prevention. We are collectively responsible for prevention in the community, and it starts at home. It starts with ourselves, and it starts at home. Starts in our job places. It starts with what we're doing right now, having the conversation.
I agree, and I would like to say also, you know, it's not just you may trust your children, you may trust your parents or whoever's in your home, but there are people that come through your home and you don't know what kind of drugs they're doing on the side. And don't just have them in your medicine cabinet in the usual places where it's so easy to have access to that. And when you say safe disposal, how would I know where to go to safely dispose of those drugs?
Well, I'll say within the river region, within the river region area, there are many treatment agencies that offer safe disposal initiatives or prescription drug take back. That's the national initiative that goes on a couple of times a year. And if you're within the river region, you can easily go to any pharmacy. And pharmacies often observe take back and will take back any medications that you have that have been expired or unused. You can also connect with any drug treatment facility. They participate in take back opportunities at MAO, Medical Advocacy and Outreach. We observe take back year round. Okay.
And where are you located?
Well, we're actually located at 2900 McGee Road. Okay. And we have several different sites on McGee Road, and each of those location sites has a medication disposal bins.
Wonderful. Okay. And that's year round.
That's year round.
Oh, Elana, thank you so
You're
much
welcome.
for being with us.
You're
and
welcome.
everybody pay attention, because this is a matter of life and death. And thanks for being with us, and we'll be right back.